Bienvenue à tous. Nous sommes très heureux que vous êtes ici pour célébrer avec nous aujourd'hui. My name is Peter Singer. Welcome. Thank you. This is a very exciting day. Thank you for joining us. For most of my career, I, like many of you, have been troubled by the inequities in health in the world. Why is it that my daughters will live to be 80? Because of the good fortune to be born here in Canada. When a girl born in Africa can only expect to live to be 40. Why is it that a child born in a developing country is 13 times as likely to die under the age of 5? Why is it that almost 1 million people, most of them children under the age of 5, mostly in Africa, lose their lives every year because of malaria? The solutions to these problems are complex, and they require some of the best minds and the best ideas from many fields: science, medicine, academia, business, and government. The solutions require focus, they require funding, and they require innovation. The need is so great. The potential to make profound change so significant. The opportunity to save thousands of lives within our reach. I am so proud to announce the realization of a dream, of a commitment by so many, of a global vision. I would like to introduce you to Grand Challenges Canada, Grand Défi Canada. Like our logo, we will soar through innovation, through dedication, and through commitment. We are a brand new, independent, not-for-profit organization, and through innovation, we will help to transform global health and help to define a new role for Canada in international development. At this time, I want to thank the Government of Canada for its vision and for its support. The Honorable Lawrence Cannon, Minister of Foreign Affairs, and the Honorable Jim Flaherty, Minister of Finance. Minister Flaherty joins us today. Minister, thank you so much. And would you please say a few words?
Well, thank you, Dr. Singer, and thank you as well to everyone for being here this morning. A good turnout at the launch of a groundbreaking program. Je vous remercie ainsi que toutes les personnes ici présentes pour le lancement de ce programme innovateur. It is always a pleasure for me to return to Mars. I remember well back in 2002, 2003, when I was in the provincial government in Ontario, shepherding this Mars idea through cabinet, encouraged and led along the way, of course, by John Evans and Cal Stiller and others. That resulted in being out on the sidewalk here at the corner of University and College with, I was the provincial minister, and Alan Rock, who I saw the other evening, was the federal minister of industry, and doing the announcement out by the hoarding out on the sidewalk here in the rain, as I recall, on a Thursday morning back in 2003 or so. I'm not sure if the government's really understood what we were getting into, but that doesn't matter that much. It's worked pretty well, and I was Alan was the Minister of Industry, and I was the the Minister of Enterprise, Opportunity, and Innovation, which had the acronym MEOI, the regrettable pronunciation of which was meow, which I had to live with for a couple of years when that was my job. But this was a special initiative, and it was the first time, I think, that governments in a big way in Canada, including the government of Ontario at the time, looked at the importance of innovation, research, innovation, and commercialization, and the interconnectivity of those. So I'm pleased to be here today. I wanted to be here today. It's always good to get away from Ottawa. Sometimes people think Ottawa is more aptly named Mars than the corner of University and College, but it's it's good to be away. I know some finance officials are here, Department of Finance, and I congratulate them. Some people think that, finance is just about numbers and, the odd bailout here and there, which is a lot of this past weekend was about. But we actually, in finance, do deal with a lot of the international issues, and I'll mention them in a moment. I know the Gates Foundation is here as well, and the good work that they do. But several of the international initiatives that we've taken as a government over the past more than 4 years now have emanated from the Department of Finance in cooperation with the Department of Foreign Affairs. So today's launch of Grand Challenges Canada is another example of how Canada's aid dollars will make a real difference. I am pleased to announce that the Government of Canada is committing $225 million over 5 years to support global health issues through our Development Innovation Fund. I'll say it again in French to see if I got the amount right. It's bad if the finance minister gets the amount wrong. Je suis heureux d'annoncer que le gouvernement du Canada s'engage à verser 225 millions de dollars sur 5 ans pour appuyer des enjeux de la santé mondiale pour l'entremise de notre fonds d'innovation pour le développement. Now, we introduced the Development Innovation Fund, this federal fund, in the 2008 budget to support the world's best minds in the search for breakthroughs in global health and other areas. Now, any initiative that calls itself Grand Challenges is certainly setting its sights high. But then again, so has Canada throughout its history. When Banting and Best isolated insulin, when doctors at the Hospital for Sick Children in Toronto developed Pablum, when cobalt therapy ushered in the age of modern nuclear medicine at London, Ontario's Victoria Hospital, Canadians were responsible for saving lives of countless people around the world. Of course, the world now is not lacking in challenges. 9 million children die each year before their 5th birthday, the vast majority of whom live in poor countries. Yet almost all health research is targeted not at them, but the developed world. This unacceptable reality demands solutions, which is why the world must gather together its best and brightest to come up with them. Our government has made sure Canada has played its part in this effort. So, for example, again in Budget 2008, our government announced a $20 million contribution to the Gairdner Foundation, in part to institute a new Global Health Award, the Canada Gairdner Award, that targets health issues affecting developing countries. Today's launch of Grand Challenges Canada will take us even further toward realizing global health solutions. Under the tireless leadership of its CEO, Dr. Peter Singer, it can make a powerful impact in breaking down barriers to health. Its mission is to identify critical global challenges, provide researchers and organizations with the resources necessary to confront them, and encourage philanthropists and the private sector to support those efforts by commercializing the results and delivering them to where they are needed most. When fully operational, Grand Challenges Canada will identify, fund, and support a total of 5 grand challenges in global health. The first, in partnership with the Bill and Melinda Gates Foundation, is point-of-care diagnostics, introducing effective diagnostic tools to enable the world's most remote and impoverished areas to receive treatment closer to their homes, even when attending a medical clinic isn't an option. These tools could help prevent up to 300,000 malaria-related deaths a year and avoid 450 million unnecessary treatments not to mention preserve medications for those who actually need them, and minimize the drug resistance that results by giving medications to people who don't need them. It's a partnership that can save lives, which is why our government is participating in this worthy endeavor, along with the International Development Research Centre, the Canadian Institutes of Health Research, and the McLaughlin-Rotman Centre for Global Health. We recognize that governments don't have all the answers, but they can invest in people who do. That is why, and I'm going back a bit now to Rome in February 2007, when I was there with the Italian finance minister and others to announce the advanced market commitment, which is a commitment with the private sector, with private pharma bidding to provide vaccines at reasonable cost to the world's poorest nations. The first initiative, and there are bids on this now, it's coming along quite well, relates to the pneumococcal virus. It was why, again, and this was less than 2 weeks ago, I joined Bill Gates in the cash room of the Treasury with the Secretary of the Treasury, Tim Geithner, and the finance ministers of various other countries, including Spain, that are participating in the launch of the Global Agriculture and Food Security Program to boost the funds available to tackle global hunger and poverty and encourage additional contributions from around the world. And again, that, like this partnership, that's a partnership that involves the private sector, involves the World Bank as a trustee. Again, another example, like the advanced market commitment with respect to the pneumococcal vaccine virus, that has partners coming together so that we can commercialize that which needs to be done. It is why we are committing funding today to ensure, just as we are through our G8 and G20 efforts in maternal and child health, that Canada continues to lead the way in making a better, safer, and healthier world. It is often said that great minds think alike, and that may or may not be true, but get a team of minds together, of great minds together, like in this room, thinking together to solve common problems, the possibilities really are limitless. And when I was preparing to be here today, and I looked at the team that's been assembled, Dr. Singer, of course, and the medical researchers and specialists, the universities that are here, President Naylor is here, the University of Toronto, President Chakma is here from the University of Western Ontario, and a terrific chair of Grand Challenges Canada, and Joe Rotman. I know that this is a team that understands the vital roles of research, innovation, and commercialization, and the interconnectedness of them. I wish you every success. Thank you.
Thank you very much, Minister Flaherty, for joining us today. Thank you for your vision and for your commitment, and our thanks to the Government of Canada. Others who have been so supportive of Grand Challenges Canada also join us today, and I would like to acknowledge and thank them. Mr. David Malone, President of the International Development Research Centre and a member of the Grand Challenges Canada Board of Directors. Thank you, David. Le Dr. Alain Baudet, des Instituts de recherche en santé du Canada et membre du Conseil Grand Défi Canada. Merci, Alain. Dr. Bob Bell, President and Chief Executive Officer, University Health Network, and member of the Grand Challenges Canada Board of Directors. Professor David Naylor, President of the University of Toronto. My colleague, Dr. Abdallah Dar, Grand Challenges Canada's Chief Science and Ethics Officer and Chair of our eminent International Scientific Advisory Board. Mr. Andrew Taylor, our Executive Vice President, and I'm also very pleased to welcome Liz Dowdswell, another member of our Board of Directors and President of Council of Canadian Academies. As the Minister mentioned, President Amit Chakma from the University of Western Ontario, Dr. Ilse Trunicht, who's the CEO of this fantastic facility, and also a particular welcome to Dr. Mohammed Hassan, the Executive Director of the Academies of Sciences for the Developing World and the President of the African Academy of Sciences. Thank you so much for joining us, all of you. Thank you all for being here today, and thank you for your commitment to Grand Challenges Canada. And I'd like to thank all those people that I mentioned. Now, as Minister Flaherty indicated, there will be 5 grand challenges, and I'm proud to say that the first grand challenge will be undertaken with the Bill and Melinda Gates Foundation. The first grand challenge will be point-of-care diagnostics. The goal is to improve the diagnosis of diseases afflicting millions in the developing world by bringing efficient and rapid diagnostic tools to the patient's bedside in rural Africa. And Minister, if you could come back to the stage and just help me demonstrate what we plan to do. So, Minister, this is how diagnosis is made now in many clinics and laboratories in Africa. This is a great innovation. It's only a couple of hundred years old. The problem is that it requires sending samples far away, waiting a long time for those samples to return. Are you able to hold that, Minister?
With 2 hands.
Yeah. With 2 hands. So that's the way things are done now. This is where we're heading. These are point-of-care diagnostics. This represents innovation. This is a diagnostic test that's done at the patient's bedside. It's more affordable, done right away, example of innovation saving lives.
How many? How large a difference will it be?
Well, you know, diagnostics is a fantastic entry point to saving lives. As a physician, I can tell you that diagnosis is the prelude to treatment. And for example, in malaria alone, hundreds of thousands of lives, between 100,000 and 300,000 lives, could be saved through improved diagnosis, and millions, hundreds of millions of unnecessary treatments, which is for the wrong disease, saving money and ameliorating the problem of resistance. So, Minister, this is where we are. This is where we want to be. This is the difference Grand Challenges Canada tries to make, innovation saving lives. Thank you, Minister Flaherty, for helping to demonstrate the world of difference between where we are and where we want to be in global health. Improved diagnostics will save lives and will dramatically reduce unnecessary drug treatments and drug resistance. We are delighted to have joining us today my friend and colleague, Dr. Carol Dahl, Director of Staff in the Global Health Program at the Bill and Melinda Gates Foundation. Carol, would you take the podium and address the audience? Thank you so much for coming.
Thank you, Peter, Minister Flaherty, and special guests. I'm very delighted to be here today for this exciting announcement. The Bill and Melinda Gates Foundation has had a long and productive relationship for many years with the McLaughlin Rothman Center for Global Health. Dr. Singer and Dar have been important partners with us in work we have ongoing in helping us identify the grand challenges in global health and also participating in our own programs to actually address these grand challenges that have been identified. The Bill and Melinda Gates Foundation's Global Health Program focuses on harnessing advances in science and technology to actually alleviate the greatest global health problems for the poorest countries of the world. We do this through creating technology-based innovations, health solutions that can actually be delivered in the field to have health impact. Through the Grand Challenges in Global Health Initiative, we have been focusing on bottlenecks that actually limit the ability to create those health solutions. We recognize innovation is key to transformational changes in health in the poorest populations of the world. We believe that innovations in science and technology can actually make the difference. We believe this because we already see the challenge that exists, but also the transformation that is happening with existing and new innovations that are coming in vaccines, drugs, things like insecticide-treated bed nets, in terms of changing the ability for people to have a healthy life in those situations. We're very supportive of the new Canadian effort in Grand Challenges Canada. We feel this sets an important precedent for focusing foreign assistance on support for building focused capacity in these areas for essential research and development in the developing countries. Mining the knowledge and skills of local scientists will not only unleash creativity in creating solutions that are more appropriate and discoveries that can actually change and transform the health equation in those countries, but will also leave a long-term legacy of creativity and scientific excellence in the developing world. Tapping the excellence of Canadian investigators, the outstanding research resources they have available, will also accelerate and strengthen the program. We're very pleased that the first focus for the Grand Challenges Canada will be on point-of-care diagnostics appropriate for the developing world, and we're very pleased to be partnering and working together towards this positive outcome. So why is this so important? Many of you in the room may be parents, and you've had children who've been sick, children where you didn't know what to do in order to make that loved child feel better and have a better chance for survival. What did you do? You turned to your local doctor. You maybe went to your local hospital as a way of looking for somebody who could tell you what was wrong with your baby, how you would actually step in and intervene, and what kind of drug or other kind of intervention you could provide. Imagine the scenario for a mother in sub-Saharan Africa. It's quite different. Each child in her family may actually have fever and symptoms, be sick with fever so that they don't feel like they can move, they can actually function in a way that happens more than once a month for each child in that family. And yet that parent doesn't have a local doctor. They don't have a local clinic or hospital to go to. In fact, they have to make a decision about whether they abandon their other children for the day, their crops, the work they need to do in their fields, their animals, etc., their ability to go and gather water for the day to actually make food and make sustenance for their family. Abandon that to actually carry that child to a clinic that may be a half a day's walk away and actually get an informed decision about what to do next. So as a result, many times parents don't have the ability to do that. They can't pay a week's pay to actually take a bus or get some other transportation. And so they make a decision just based on experience. We know that children are dying because they're getting the wrong drugs or they're not getting treatment at all for a life-threatening illness. And so that a change needs to be made. What is needed to make the change? It's, as Peter said, it's diagnostics for the diseases of the poor, for the diseases of those tough settings of the world where they don't currently have diagnostics at hand. Diagnostics that can inform the decisions of parents and other caregivers about what to do next. So what do those diagnostics need to look like? They need to be small, they need to work without clean water, they need to work with minimal amounts of electricity. They need to also be able to be used by people who don't have sophisticated medical training. Will this be hard? Yes. That's why it's a grand challenge. Can it be done? Yes, we believe it actually can be. We think there are science and technology that can be brought to bear right now to create solutions, much as the ones Peter was holding in his hand, that can actually be brought to populations that currently don't have access to informed decision-making about their health and the health of their beloved children. This is why I'm so excited to be here today, and I'm very pleased that the Gates Foundation is going to be working together with Grand Challenges Canada on this critical issue, which is point-of-care diagnostics for developing countries and resource-poor settings. Your commitment to innovation will help save the lives of so many across the world. Thank you.
Well, thank you very much, Carol. And of course, we're thrilled to be working with the Bill and Melinda Gates Foundation on point-of-care diagnostics. It's important work. It will have long-term impact. And of course, we admire the dedication and the extraordinary accomplishments of the Foundation. And we sincerely appreciate the Foundation's help in getting Grand Challenges off the ground and helping us get off the ground. Thank you very much. Now, as Dr. Dahl pointed out, Grand Challenges Canada will support Canadian scientists and also scientists in the developing world. We believe there's great benefit to tapping into the skills and knowledge of local scientists who are innovating against the very problems they face. We are very pleased today to be joined by one of those extraordinary scientists from Africa, my friend and colleague, Dr. Muela Malechela, who's the Acting Director General of the National Institute for Medical Research in Tanzania. and Muela is also a member of the Grand Challenges Canada Scientific Advisory Board. Muela has made a special trip from Dar es Salaam to join us today, and Muela, I'd like to welcome you to the podium and maybe begin by telling us how to say Grand Challenges Canada in Kiswahili. Well, thank you, Muela. Welcome. Thank you.
Bonjour, Madame et Messieurs, and I will stop there. And first of all, try and say Grand Challenges in Kiswahili, which is mikakati ya kupambana na changamoto katika afya za jamii Canada. Grand Challenges Canada. Distinguished guests, ladies and gentlemen, Honorable Minister, I am honored to be here today at the launch of this great initiative in global health. I would like to thank the Grand Challenges Canada and the Mars Center for making it possible for me to be here today, and to thank them for their great hospitality. It has taken me 36 hours door to door, but it has been very much worth it. Ladies and gentlemen, let me applaud the Government of Canada for launching such a great initiative. And for me, this focus on innovation for improving the health conditions in developing countries is great. But greater still is the fact that people in developing countries have the opportunity to work either on their own or with their partners in Canada to find these innovative solutions. And I think for me, that's part of the greatness of this initiative. This will lead to capacity building for people in developing countries to work on areas that make the most relevance and bring about the most change. As we all know, sub-Saharan Africa, predominantly north of the Limpopo River, which means north of South Africa, lags behind in the area of science, technology, and innovation. And it is crucial to the development of these countries, such as my own, to see these weaknesses addressed. The multidisciplinary, multinational composition of the International Advisory and Scientific Board, of which I am on, lends credence to this fact, that this is indeed an initiative that is serious in spearheading innovation in global health for developing countries, whilst at the same time striving for excellence and bringing the developing countries onto an equal playing field. Another impressive addition to this initiative is the support for the social business and institutional arrangements that will ensure the effective transfusion of the resultant technologies. We have seen so many times that technologies are found, but then they never reach the field. They end up in people's drawers, people's desks, but they're never actually translated into something that can be useful. There are several ideas that have never seen the light of day, mainly for reasons of sometimes people just don't know what to do. So this is a great addition to this fantastic initiative. Ladies and gentlemen, my colleagues have talked about the initiative in great detail, but I thought it would be pertinent for me to add my voice to theirs. However, I would like to talk more about the specific areas where innovative solutions are needed, and specifically point-of-care diagnostics. On the screen, you will see some images of the clinics that we have in Tanzania. They are the basic metaphor of the care that is currently available. And ladies and gentlemen, people have to walk 15 to 20 kilometers to reach these clinics. It goes without saying that rapid diagnosis is the key to improving health service delivery worldwide. Carol, Peter, and the Honorable Minister have all talked about the point-of-care diagnostics and showed the importance. In fact, the demonstration by the Honorable Minister and Peter is a clear indication of exactly what is needed and how far this change will take us. It goes without saying that rapid diagnosis is the key to improving health service delivery worldwide, but more so in developing countries where infectious diseases are the main causes of morbidity and mortality, and where chronic diseases are currently on the increase. It is evident that rapid testing for malaria, for example, in my own country, has resulted in prompt diagnosis and treatment and averting several unnecessary deaths from malaria. More specifically, it has also been shown that rapid testing has decreased the overdiagnosis of malaria, ensuring that only those who do have malaria are treated. Making point-of-care diagnosis available would reduce the lag time, and this is something that Carol really stressed in her example of the sick child, between diagnosis and treatment, and hence really improving patient care. This would revolutionize healthcare in the developing world where there are so few skilled staff. That's a big problem, the issue of healthcare providers, the human resource for health crisis that we face in our countries, and a heavy workload in terms of patient numbers, resulting in long delays between treatment and diagnosis. The concept of point-of-care diagnostics is not new. The glucometer for diabetes has been on the market for several years. Others are pregnancy tests, protein strips, and the like. The challenge is to make diagnostics like these available for more conditions, and conditions of the developing world. Make them affordable and yet of good quality, with high specificity and sensitivity. I ask myself, for example, could we develop a low-cost test or diagnostic that will indicate a woman has preeclampsia and avert several maternal deaths? In my country, ironically, 13,000 women die each year while trying to bring life into the world. And out of these, 17% die of eclampsia, pregnancy-induced hypertension. This figure is also, as most people say, there's a lot of underreporting because half of these women don't even make it to the health facility. These are unacceptably high numbers. They're unacceptable by any standard. They're unacceptable in Canada, they're unacceptable in Tanzania. There are several situations and conditions where rapid diagnosis literally saves a life. The explosion of mobile technologies in Africa, which is another example of how the point-of-care diagnosis could be used, has resulted in them being used from selling produce to promoting messages on HIV/AIDS and malaria. Could this technology provide a platform for antenatal support and follow-up in pregnancy complications? Is this not something that we could think about while we think about all these grand challenges? I'm sure that working with our colleagues here in Canada, there are ways that we can find solutions to these very real problems. I do hope that we do not end at finding the solutions, but also ensuring that these tools become accessible to those who need them most. Thank you for your kind attention. Merci, mesdames et messieurs. Merci beaucoup pour votre attention.
Well, I thank you so much for making the trip to Toronto to share with us your firsthand experience from Africa with respect to the health challenges that you face and how innovation could help. It will take a bold effort to find and implement the sort of long-term solutions that Dr. Malacella was talking about. Grand Challenges Canada is bold and unique because of its approach. We call it integrated innovation. Our focus on innovation includes scientific and technological innovation, but it also includes innovation in social models, in business models that's needed to take that science and technology to scale, to bring those technologies to those who need them so desperately. It will take all of us working together to find sustainable solutions. It's a comprehensive and integrated approach right from the beginning. That's the difference, and it's how we will make a difference. We have some great scientists in Canada. Grand Challenges Canada will support them to dedicate themselves against the great health challenges of the world, to test their bold ideas for humanity. And I would now like to introduce you to one of these inspiring young scientists. Dr. Carly Silver is a Canadian scientist born in Winnipeg, a graduate of the University of Winnipeg and a Rhodes Scholar. Carly graduated from Oxford with a DPhil in medicine. Dr. Silver is now part of the Grand Challenges Canada team, as well as working in a laboratory with Kevin Kane on issues in malaria. Carly, would you come to the podium and address the audience, please?
Thank you, Peter. It's an honor to be here today to celebrate the launch of Grand Challenges Canada. As a Canadian scientist, I am thrilled with the opportunities Grand Challenges Canada will provide to make a difference in the developing world, where there is so much work to be done. Global health issues attract young scientists like myself because there is such a potential for your work to make an impact. And yet these are truly intellectually challenging problems. After I left Oxford, I had the opportunity to travel through Southern Africa. It was a life-changing and career-changing opportunity. It was the final of many inspirations which pointed me in the direction of global health research, specifically malaria research. One particular village that I visited, Kandy in Malawi, is a place I'll never forget. From the village and the countryside, people would come to the health clinic in Kandy. It's the only one around, and it's far from what we would imagine a clinic would be. There are 3 rooms, a waiting room and 2 offices. The walls are gray concrete, and certainly the clinic did not meet any Western standard for sterile environment. It's staffed by 1 medical officer, and when I was there was at least 30 people waiting for treatment. Most of them were women with their sick children. What amazed me the most was that there was absolutely no medical supplies, none. The best this beleaguered technician could do was send these sick people further away, somewhere else for treatment. He couldn't help. He couldn't diagnose what their problems were or provide the treatment. And like so many clinics in Africa, providing rapid, accurate diagnosis and care is virtually impossible. The equipment is outdated. Results come back days or weeks later when immediate intervention is needed. We can do better. Grand Challenges Canada, and specifically the first Grand Challenge, Point of Care Diagnostics, will do so much to address these challenges. For Canadian scientists, this presents an exciting opportunity to apply the knowledge, skills, and specialized technology we possess towards challenging problems for which solutions need to be urgently found. And certainly the opportunity Grand Challenges Canada offers Canadian and developing world scientists to work in partnership to find innovative solutions will bring lasting change to health conditions in developing countries. As well, that collaboration will lead to strengthening scientific innovation where it's needed most. And no doubt the flow of information will be both ways. There's a great deal to be gleaned from every collaborative interaction, so as Canadians, we're going to be learning too. We are fortunate. Canadian scientists are well received in the developing world. We want to harness that potential to do some good and make an impact on global health. Thank you.
Thank you very much, Carly. Minister, distinguished guests, fellow participants in this wonderful initiative. I personally am inspired by the passion and dedication of young scientists like Carly. And Carly, you make us all very, very proud. We all know we need to assemble the best minds in Canada and the best minds around the world to solve these global health issues. Impossible is a word that is not acceptable, and we must try. My name is Joe Rotman, and I'm chair, and I'm proud to be chair of the board of Grand Challenges Canada. The creation of Grand Challenges is a culmination of a dream for my wife, Sandra, and I to play a small part in using the power and effectiveness of innovation to address the persistent challenges of improving the health and well-being of all people. I'd like to use my time at the podium to thank a few for their commitment to this most worthy of endeavors. And although these people have been thanked before, I would appreciate your bearing with me to allow me to do so as the chair and as someone who has helped bring these people to the table and who without the initiative would not be in existence today. Obviously, the Government of Canada for its insight and its courage to support this bold idea, Grand Challenges Canada, through the Development Innovation Fund. How fortunate we are as Canadians to have the commitment of Minister Flaherty to push boundaries. Minister, through your political career as Minister at Queen's Park, and now as our Minister in Finance in Ottawa, you have maintained your commitment to the power of innovation. You supported the vision in the development of Mars, as you referred to, and now you're supporting Grand Challenges Canada. I personally want to thank you, and on behalf of all Canadians, and possibly all citizens around the world want to thank you for your unwavering belief in the ability of individuals and groups to enhance our country, Canada, and the world. I also want to thank our consortium partners that Peter made reference to. In pulling something like this together, one of the greatest problems is ensuring you get the right people at the table and that the culture blends. And I couldn't be more happy to acknowledge my partner, Mr. David Malone, or our partner, David Malone of IDRC, who I've gotten to know and enjoy working with. And on last week we talked, and it's been a wonderful mutual relationship that I look forward to and doing wonderful things, David. And Dr. Alain Baudet from CIHR, who also has supported this. Alain and I have worked together several times on many initiatives, and since day one, we have had a common bond in pushing the envelope. I would like to recognize my friend, my dear friend, Dr. Howard Alper, Chair of Canada's Science and Technology and Innovation Council, for providing the constant, persistent, determined, encouraging me to move forward with grand challenges. We have benefited enormously over the years from the commitment of our board of directors, a wonderful group of people, our scientific advisory board from around the world. These are some of the brightest minds in the world. Some of them have come a very long way to be with us today. Dr. Mwela Malekela, obviously from Tanzania, where I visited the kind of health center you talked about when Barrick Gold opened its mine in northern Tanzania, just south of Victoria. And it was one of those experiences that motivated my wife and I to take an interest in global health, and it was quite fascinating to see that picture. She, as Peter said, she is Director of Research Coordination and the NIH for Medical Research in Tanzania. And Dr. Mohammed Hassan, who willingly committed to help us, and he is the Executive Director of the Academy of Science for the Developing World and the President of the Academy of Sciences. I am deeply grateful to all of you who have been participants in this wonderful voyage for your time, your knowledge, and all you've contributed to shape the direction of Grand Challenge Canada. Let me now move to a small group of staff who helped make this come to life. You've heard Dr. Peter Singer speak. As Chief Executive Officer, Peter, you are tireless, you're a visionary, you've got a big heart and bold ideas. Dr. Abdullah Dar, Chief Science and Ethics Officer and Chair of the Scientific Advisory Board, your wisdom, scientific leadership, and global credibility strengthens the foundation of this wonderful endeavor. Andrew Taylor, where's Andrew? Andrew is at the back there. Vice President, who makes sure everything is done to perfection. And having someone there gives me the confidence to dream big, because I know things are being done properly, effectively, and efficiently. Dr. Carly Silver and all of the other scientists whose passion, intelligence, energy will contribute much to this endeavor. Lynn Whitman, who has guided us through the communications activities. Sandy and I are personally very proud to be a part of helping Grand Challenges come off the ground, and I know we in this great country of ours, Canada, will make a difference. Thank you.
Thank you, Mr. Rotman, for your very kind words. We all realize that we wouldn't be here today without your outstanding chairmanship, and it's very greatly appreciated by everyone in the room, and I think all citizens of Canada. Thank you very much. So this concludes the formal presentations. We'll now take questions from the media for the next 10 minutes. There will be handheld microphones provided for your questions. And after this Q&A session, Mr. Flaherty will take questions in a scrum on issues of the day, for example, Greece, if required. For this Q&A, please confine your questions to this announcement of Grand Challenges Canada. The floor is now open for questions from the media, and I'll call upon people as you address them. Okay. I think in that case, I would like to thank you all very much. I thank our board of directors who are here, our scientific advisory board. This is an extremely exciting day, an extremely exciting moment. I think we will look back 5 years from now, 10 years from now, and say this was a historic day for our great country. And I'm very, very pleased that you all came. And today, the hard work begins. Thank you all very much for coming.